Hello, everyone, and welcome. No need to introduce this man, Don Avery, CEO of Fairview Park Hospital. You've been on with us several times. As I remember, the first time you were on with us, Don, was in a Zumba class. Do you remember that?
I do remember that. I think that was my second time,
Okay.
but that was at least my most infamous time, yeah.
You know, the personnel here in talking about Fairview Fitness or the cardiology or Dr. Agarwal, one of the newer doctors here, how do you attract such good people, not just doctors, but nurses, and I'm speaking from being in here as a patient, and it seems like everybody, the girl bringing you lunch from the cafeteria, or the nurse waiting on you, or the doctor, they just have a certain type of enthusiasm to want to take care of the patient.
Well, I'd like to take a lot of credit for that, but the reality is we have a great culture here. A lot of people are homegrown. They're from here. They're from Georgia. And the nature is, it goes back to something our marketing director, Tracy Morgan, said several years ago when I first got here and we were talking about, what should the face of this organization be? And she said, we're neighbors taking care of neighbors, and that's really what we are. And it's not just neighbors from Dublin or neighbors from Lawrence County. It's, Middle Georgia, and we care for people as if they're our family. And we don't just say that, we really do that. But that there's a culture here that people know is palpable. People from outside the organization or folks that visit here, they feel it. And people talk to each other and care about each other. And we're more than just co-workers because particularly in a community where you go to church with people, your kids go to school, they're involved with their extracurricular activities, and we have an opportunity to care for those people. And then we also, play with them and go to work with them and see them in the community. And I think that makes a big difference. And I think that's the culture we have here at Fairview.
And one of your top priorities has been to attract new doctors, and you seem to have great success with that.
Well, we have had great success, and again, it's a team effort. I've got this philosophy that really it comes from a Teddy Roosevelt quote. He says, "You hire good people and let them do their job. Stay out of their way." And we've got a lot of people involved in the recruiting process, not just here. The community helps us, realtors and educators and folks in the chamber, they help us recruit when we bring somebody to town. Again, whether it's a new leader like our new Chief Operating Officer, Matt Hasbrook, or whether it's some of our new doctors, we've recruited to this community over 50 doctors in the 6 years I've been here. And people told me you'll never be able to recruit doctors. In the previous 5 years we had recruited one doctor, and I said, well, my wife and I wanted to move here, and they wanted to live here. A lot of people want to live here. And we showed them what the benefits of living in a smaller community, having access to larger metropolitan areas, what those benefits are. And again, that same culture you referred to a moment ago, that is attractive to people as well. And we've recruited a lot of doctors, and they've stayed. And that's a good thing. We have almost, 8 or 10 more doctors joining us this summer in various specialties, so we're real excited.
And is there any niche that you don't cover here? I know you, Dr. Agarwal, you got pulmonary, and I was trying to think today, is there anything that we don't do here?
Well, there are a couple things. You mentioned Dr. Agarwal. We had gone for about 4 years without a pulmonologist, and we really hadn't had a critical care specialist for a number of years. And so last year we recruited Dr. Vishal Agarwal. He's a board-certified pulmonary care specialist and critical care specialist. And we've got another person joining him. And again, it's a homegrown doctor. It's a lady named Dr. Mary Hoffa. Her father, Danny Hoffa, is on our medical staff. And Mary and her husband are joining us this summer. He's a hospitalist. Isn't that great? We get 2 doctors for one. And so that's, again, somebody coming home. But that's a specialty we weren't able to provide. We do pretty much everything here except open heart surgery, although we have a strong cardiology program. We do stenting, and we take care of folks with heart conditions. And we don't do spine surgery, or neurosurgery. We do orthopedic surgery, a lot of it, in fact. We do, I think, between 600 and 700 surgeries last year in orthopedics, as opposed to 15 or 20 just 5 or 6 years ago. So that's another program that's grown tremendously. But we do not do neurosurgery, but we refer those to either Macon or Augusta.
Well, and I tell people all the time, there's no need to drive anywhere when it comes to medical, because, if I'm having a heart attack, well, I want to get to Dr. Vega. Orthopedic, Dr. Gay, Dr. Richter,
absolutely.
And that's why you're doing more surgeries. You've got capable, qualified people. And speaking of homegrown, Dr. Gay can't get any more homegrown.
No, Dr. Gay, you're not supposed to have favorites, but, if I can say this, he replaced my hip 6 months ago, and I'm back to full care, and I'm doing all my exercise. I even do CrossFit now. That's how good a job he did, and you don't have to go out of town for almost anything. And the reality is, I don't think people really want to. They want to know that where they're going to go has good quality, and we can demonstrate all kinds of numbers, national and state recognition we've received for quality, and people don't have to go out of town for that because we've recruited primary care doctors like internal medicine, family practice, and pediatrics. We've recruited specialists like pulmonary, like I mentioned, orthopedics, cardiology, and surgeons. We brought some surgeons on board. So the services that this community needs are mostly provided right here. They don't have to go out of town. If somebody needs to go out of town, we're going to help them get to where they need to be, though.
Y'all do so much in the community. Of course, being a local TV station, we know a lot of things, and we try to get the word out, but y'all do so much in the community. HCA is big community, of course, Fairview Park, but it could be you just left the Rotary Club meeting. You do a lot with Rotary, or y'all help down in Truitland County with the ambulance service there. The same here. Y'all are coordinating. People don't realize the coordination because when that ambulance picks you up, they're talking to somebody at this hospital. And if I'm having a heart attack, they're getting them girls into place, getting Dr. Vega into place, and they're reading the printout. So we should feel good about that as a community, shouldn't we?
Well, we should. And there's two aspects of what you said. First of all, somebody does have an emergency and gets transferred, or maybe coming here, maybe going somewhere else. We're helping coordinate that. If someone has a heart attack, they call 911, they get hooked up to an EKG. We can actually begin treatment in the field. And by the time they arrive here, we're ready to take them right to the cath lab or take them to, somebody's having a stroke. We immediately get them to get a CT scan so that they can determine whether we start treating them with a particular drug or not. And those kind of things happen much, much faster. And again, we have an accredited chest pain center now, which we didn't have a few years ago. We're an accredited stroke center, which we weren't a few years ago. And in terms of our commitment to the community, it's not just to provide care and ask people to come here so we can care for them, but we help volunteer organizations in town, both in our time and financially. A number of our employees, not just the leadership, a number of our employees serve on boards. A lot of people go unnoticed, because they're doing that. Their churches or a local community, boards like the local technical school or organizations like the American Cancer Society or Stepping Stone, just various organizations in this community that we try and serve. We can't do everything, obviously, but we feel like we have an obligation, but really a privilege to serve organizations in this community because, again, it's a partner, it's neighbors taking care of neighbors, and it's us being a part of a community. And I tell the leadership with HCA that we're not just a hospital, we're a community, and so we're here to serve a community in a region, and hopefully we do a pretty good job of that.
How many employees now?
Well, over 700 full and part-time. You look at, there's all kinds of data and everything we look at. We have probably 530 or 40 what we call full-time equivalents, but that represents, probably nearly 750 people that work here full or part-time. We're pretty proud of the fact that, we're one of the top, one or two employers in town, both in terms of payroll and numbers of people working here, but also the presence of this hospital creates other jobs. Mm-hmm. Some of the other healthcare agencies in town, hospice or home health agencies or other organizations like that, wouldn't be here without this hospital.
Medical supplies.
Absolutely.
Yeah.
So it's
all these offices around this house on the campus here, what I call the campus of Fairview. But because everybody comes to town here to come to the doctor, Truitland County and Johnson County, and you service probably 250,000 people or so. Is that
I think that's pretty much the market. And in those communities around us, some of them have smaller hospitals, and we have a relationship with those. I know the administrators and have a working relationship with administrators in all those hospitals in Washington County, in Sandersville, in Dodge County, in Eastman, or up in Millersville, and over in Cochran. Those hospitals, we don't just serve the people in those areas. We try and serve those hospitals too, because we have services that they aren't able to offer. And so we try and help them get their patients where they need to be and then get them back to them, too. So our goal is to really serve this whole region, whether it's a local hospital or an individual or even a physician who has a need. So
okay, equipment. Y'all have invested probably millions. People really always say, why is healthcare so expensive? Well,
the equipment.
They don't give it away, do they?
No, they don't. And everybody wants to have all the latest equipment, and you try and keep up with that. And we've done a pretty good job of that over the past few years. We've replaced most of the equipment in our imaging suite, radiology. And there's a lot of equipment there. We just, a few months ago, finished installing a second CT unit. It's a 64-slice CT, which allows us to do some cardiology procedures we weren't able to before. It allows us to scan patients much faster than our 16-slice, although we keep both of them. But it also allows us to move people through the ER faster. The highest percentage of CT scans come out of the ER. And so we can do those much faster. In fact, the new one is just right next to the CT.
And you see it better, right?
Don't you? It's the images are better. And in fact, even the 16 slides, we upgraded the image quality on that. We're adding a second digital mammography unit. It's interesting to compare to one of the hospitals in Macon. They have two mammography units. They have 2 more employees than we have, and they do fewer procedures than we do. So we're actually adding a second mammography unit, again, digital. So we'll have 2 digital units in our mammography suite. We're going to do some other renovation across from there to bring all of our ultrasound in the same location. So we'll have all that, what we might call women's imaging services, ultrasound and mammography, all right there together. But we're real happy about that because we do a lot of procedures, and we'll be able to get people through them faster, I think.
We had one of the best shows we've done the last few years. We had the Jaspers on. What a great family. We had 3 Jaspers on, I think, actually, before it was all said and done. But, of course, they've been on other shows, Amazing Race, True Stories of ER.
True Stories of the
Is
ER.
That what it's called? Yeah. You got them back. They left. Now you got them back, right?
We do. Travis and Nicole Jasper are married, and then Travis's twin brother, Trevan Jasper, works here. So all 3 of them, if I could just get them to move to Dublin and stay here full time and work for me full time, but we get a lot of shifts every month from them, and they're very, very good doctors. They're wonderful people, and we're real glad to have them back. And they're a little bit of celebrities because of their TV shows, but apart from that, they have really provided great care for our patients. And, of course, that's another area. Our ER, 6 years ago, we were seeing 28,000 people. In the last 2 years, we've seen over 38,000 people each year in the ER, and we see that continue to grow. A lot of people utilize the ER. We've got more doctors covering specialties that allow us to see more patients in there. So that has been an area where we've grown the number of doctors and grown the number of nurse practitioners and physicians assistants that work in the ER, and nurses, of course. And so we are meeting the need there, too.
And one of the best things I hear of Fairview is speeding up those ER times. How did you do that?
Well, we have some processes in place where people aren't waiting in the waiting room as much as they had before. In fact, we've dropped that dramatically. So they see a provider sooner. And we still, again, with that number of people, eventually we're going to need to grow our emergency department. And again, when you grow it, add some more staff down there to get people through even faster. We're getting them back to be seen faster. And then there's still a lot of things that have to be done. Other things we're looking at trying to speed that process up. This CT unit I mentioned, if you cut off 15 to 30 minutes, in getting a CT done, and how quickly can we get lab work done. So we look at every component of a patient's stay in the ER and try and expedite that. Like I said, that big number of people, 70% of our inpatient volume comes out of the emergency department, so it's pretty important that we don't waste a lot of time keeping them there.
Mm-hmm.
If they're going to be admitted, we want to get them admitted. If they're not going to be admitted, we want to get them treated and sent home. That's what they want, too.
And you've got doctors making those decisions.
We got
that's
plenty of doctors.
Yeah.
Well, trust me, you don't want me making that decision.
Yeah.
I want to make sure that there's a system in place where they can do their job. That's my goal, is to help give them the resources they need to do their job. And so that's what takes a lot of my time, is making sure that all those numbers work out.
And explain, and I was in here in December, but I didn't even have to go through ER. I was a direct admit. Where did that idea come from? When you have such a sick patient, instead of laying around in an ER bed or something, getting sicker or possibly worse, Where did that come from?
Well, our desire would be to have more patients be admitted, what we call a direct admit, as you just mentioned. If you've seen a doctor, and I think you came from a doctor's office, and that doctor determines you need to be admitted, we can save time, money, and the patient shouldn't have to incur that charge. We want to get them admitted as quickly as possible. You mentioned earlier adding new doctors. We're actually adding 5 new hospitalists, the full-time inpatient doctors, internal medicine, family practice doctors that are taking care of our patients here. That's what we do in America now. The private physician lets a hospitalist do that admission. Well, by expanding that service and adding more doctors to that, we're going to be able to take even more direct admits and get it done faster. So if your physician determines you need to be admitted, for whatever that situation might be, a cardiology, pneumonia, broken leg, whatever, there's no need to stop at the ER. Now, if someone's having an active heart attack, we want them in the ER first, and then we can get them either to the cath lab or the critical care unit. But a number of those patients that are coming from a doctor's office, we hope could be done through a direct admit process.
Okay, you mentioned earlier your new chief operating officer. We're going to have him on the next week or so. Tell us about him.
Well, Matt Hasbrook is the latest in our run of chief operating officers. I made a joke to somebody. I said, we keep getting new chief operating officers, but Matt's my 4th. Matt Hasbrook is my 4th. But the others are all CEOs now. They're all running companies or hospitals, and so they've all grown and done better. And it's kind of a training ground. This is an ideal hospital for a young executive to learn because we do about everything here. You get a chance to get involved with the community and meet a lot of folks. You get very involved with the processes here, whether it's running a department or working with the doctors, etc. Matt came to us in February, and he has not stopped running. The only thing I've got a problem with Matt is I got to send him home sometimes. He's here at 7:30, 8 o'clock at night. I don't want his wife mad at me. But Matt is doing a tremendous job. He's connected with folks. He's a smart young man. I need to make sure that the people at corporate don't know about him because I want to keep him a little longer if I can. So.
But does he work hard as Dr. Zhang?
I'm not sure anybody works that hard.
Yeah.
Dr. Zhang and his wife are neighbors of mine, and I feel like he spends so much time up here. I think she spend time home with your kids, But,
she don't like you, does she? You work with him too.
Well, I try and protect my doctors.
But the COOs they're not allowed in your office, right? Because they're not going to get your job. Is that?
Well, actually, Matt and I spend a lot of time together, and if I was going to be replaced by somebody, I guess I'd be proud to have Matt do it. But I'd like him to wait till I decide to retire, which is a few years away. My guess is Matt will be long gone before I retire. I don't know if you realize this, but last month I celebrated my 6th anniversary here in Dublin, and we have no plans to leave, and I'm pretty sure HCA is going to let me stay a little while longer. But it's been a great place for us personally to live and professionally. It just seems like there's always more challenges and opportunities in this hospital to expand the services that we're able to provide here. And I work with great people, and so we hope to stay a good while longer. I just want to keep running those COOs through here and let them go somewhere else and run a hospital. So,
yeah, that's exactly right.
Mario's down running a hospital in New Orleans, and Brad Griffith, who was here a few years ago, was in South Carolina now running a hospital. Then Mike Hoskins left, and he's running a company that manages nursing homes and hospice programs and such, and home health. And so those folks are, again, all good and talented people, and they just keep getting better. Matt's going to be another one of those guys that's going to, the sky's the limit for him. I just want him to be a CEO somewhere else.
Yeah, and obviously we were kidding about all that, but on a personal level, how does it make you feel seeing them move on and advance?
Yeah, it's one of the most satisfying things that I think any leader can do is see people that they've had a chance to invest in someone else's life and see them do well. I mean, to me, that's worth more than I get paid. It's worth more than anything else is to see people grow and really go where they want to, not necessarily grow and move on. If someone wants to stay here, we'll help them grow here. But if I can help someone fulfill their dreams, then that's a great feeling to me.
Well, we definitely don't want you to leave Dublin.
I don't plan on it.
Yeah. Well, I appreciate you taking a little time out for
My
us.
pleasure.
I know you're really
My pleasure.
busy.
Thank you. I appreciate the opportunity to talk about the hospital.
Thank you, Don Avery, CEO here at Fairview Park Hospital. Thank you for joining us.